Hello, colleagues and guys. I'm Ismaeil Dooma, pharmacist. Today I am going to talk about one point or one regulation that should be followed to uh, avoid being infected by coronavirus or COVID-19. In Sudan, people used to greet each other through shaking hands, in addition of embracing each other. WHO mentions that shaking hands is one of the means that can transmit virus between each other. Why shaking hands is dangerous? Shaking hands is dangerous because your hands usually used to touch surfaces, to touch cars, to touch tables, to touch walls, doors. These surfaces are source of infection because the virus can live on them. So when you shake your hands with another person, if you have touched a surface that is infected with the virus, then you can transmit this virus to that person, and that person, when shake another person, also he will transmit this virus to that person. So indirectly you have distributed the virus through the community. For this reason, WHO mentions that people should avoid shaking hands. How can we stick to that regulation? Since shaking hands is one of a social circumstance, you cannot stick to this regulation if you do not believe that this is one of the means of virus transmission. So it is necessary to believe that this is one of the means that can transmit virus and one of the most dangerous means. When you believe that, you can do and you can stick. So another question: what is the other choice to greet other people? The other choice is that you can wave your hands from not less than 1 meter from another person. This is enough. By this method, you can greet the others and you protect them and protect yourself. Also, many people think that when you refuse to shake your hands with them, that means you are afraid of being infected. No, I am not afraid, but I want to protect you. I want to protect the others. I do not want to transmit this virus to others. I do not want to be the source of the virus to others. I do not want to share in the risk of distribution of the virus. That is the case, not more than that. So also it is important for the healthcare providers, pharmacists, technicians, laboratory technicians, doctors, nurses. All healthcare providers should stick to this regulation because they are the leaders. They are the people who can orient the public. The public, when saw that the doctor or the pharmacist or the technician stick to that regulation and prevent himself or prevent shaking hands with others, they will follow. And I think this point or this sticking to the regulation is important, because other people, when you talk them that handshaking is a source of COVID-19 transmission, they will ask you or see you. If you shake your hands with them, they will not trust on you, because you yourself is not responsible. You cannot ask others to do something that you do not implement. So we can start to implement this regulation of prevention with ourselves, with our community. I mean the pharmacist. With our community also, I mean all other healthcare providers, because the health field is responsible of the orientation of other people to go through certain or stick to a certain regulation that can protect them and prevent them from being infected. Thank you for watching, and till we meet in another video, and we will talk about other regulations that can prevent us from being infected, because as known to, to all over the world, all over the world know that prevention is better than cure. So we can go step by step to orient all of you about how we can prevent ourselves from being infected with COVID-19. Thank you for watching. Till we meet you. Thank you.